Good morning, one and all. Today we are going to deal with the chapter of waste management. These are the following contents of this class. They are introduction, solid waste, disposal of solid waste, and disposal of healthcare waste. In the next classes, we will discuss regarding the disposal of the healthcare waste of different types of methods. Coming to introduction. Waste. Waste management is a collection and transport, processing, recycling or disposal of waste materials. The term usually relates to the materials that are of human activity and is generally undertaken to reduce their effect on health, the environment or the aesthetics. Waste management can involve solid, liquid, gases, radioactive substances with different methods for each. So, the term usually relates to the materials, especially regarding that they are produced by the human activity. So, we should reduce the waste that is being generated by us. So, the procedure of waste management is important in every country, and it is the mandatory methods where we should follow the steps of disposing the waste. Especially our healthcare waste is most dangerous and it might cause so many diseases unknowingly. So we should be taking care of how to dispose the proper disposal of the healthcare waste also. What is solid waste? The term solid waste includes garbage, that is regarding the food waste, rubbish like the papers, plastics, wood, metal, throwaway containers, glass, and demolition products like bricks, masonry, pipes, and sewage treatment residue like the sludges and the solids from the coarse screening or domestic sewage, dead animals, and the manures that are other discarded materials. Strictly speaking, it should not contain night soil. This is where the point of solid waste lies. And in that, sewage means wastewater from the community containing solid and liquid excreta derived from the houses, street and ad washings, factories and industries are known as sewages. What is meant by sewage? Water or wastewater which does not contain human excreta. This is known as sewage. So make sure that if there is a question regarding the hospital waste management or the waste management regarding that, you should classify them into the categories. So it might be a 4 marks question or a 2 marks question for the examination purpose. What are the health hazards that are being accumulated with the solid waste? It decomposes and favors the fly breeding. It attracts rodents and vermin. The pathogens present in the solid waste may be conveyed back to man's food through flies and dust. You all know, if you waste or if you keep the food in the home also, leaving 1 or 2 days, it decomposes and lots of flies or lots of worms might be formed on the food, and these might be transferred in the fresh food when you are eating. So make sure it should be disposed thoroughly. So there is a possibility of water and soil pollution. It is anesthetic and produces bad odors. So we should compulsorily decontaminate it or dispose the solid waste that is present in the homes itself. If it is been like that, it becomes degraded and bad odors might come, and if there might be the flies might be breeding them, and it might be transmitted to the other food substances which we are going to eat for the day. And how to do it? The first one is storage. The first consideration was to be given the proper storage of the refuse while awaiting collection. So the dustbin should be large enough to cater the requirements and should have a close fitting cover. So we should dispose, or that means first initially we store for the weekday or for the day itself, when the collection person might come at the delayness. Like for example, if we are going to dispose daily also, for every time we can't do it. So by storing the waste material in a dustbin with a lid or with a cover. And the second one is collection. Waste that can be collected from each house, which is the best method of collecting refuse. Another method is to have the public bins in which waste can be collected. You can all know that the collection of the waste can be done in these methods. And transport. Waste should be transported using enclosed vans to the area of disposal. So we should have a closed van, but we can see here and there that the waste that is being fall out from the vehicles on the roads itself. So we should have a enclosed vans for carrying the waste. Disposal of solid waste. The principal methods are, especially for the solid waste, methods for disposing them is dumping, number 1. Number 2 is controlled tipping or sanitary fill, that is landfill, incineration, composting, Bangalore method, that is you can see the hot fermentation process where this composting method has been set, and mechanical composting with like manure pits and burial. So these are the principal methods of the solid waste disposal. What is meant by dumping? This is the easiest method to dump the refuse in low-lying areas. So the method is to dry the refuse and is also suitable for liquefaction of the land. As a result, the bacterial action, refuse decreases considerably in volume and it can be converted gradually into humus. Definitely it might be converted into humus. And what are the drawbacks of the open dumping? Or the refuse is exposed to flies and rodents. Definitely if you are just throwing it on the open area, definitely it might be exposed to flies and rodents, and it is the source of nuisance because of the smell and unsightly appearance, and the loose refuse is dispersed by the action of the wind, and drainage from dumps contributes to the pollution of the surface and groundwater. Definitely it might happen, because if you are becoming a problem like open dumping is definitely causes these types of conditions. What is controlled tipping? That is sanitary landfill. It is the most satisfactory method of the refuse disposal which is suitable where the land is available. In this method, the material is placed in a trench. I will deal with the trench, okay, and in the other prepared area, adequately compacted and covered by earth, and at the end of the working day. So by having the waste refuse that is being layered, and where the landfill, that is we are making the soil on the refuse, so that it is like a trench method. There are three methods in this operation. They are trench method, ramp method and area method. What is trench method? This method was used which the level ground is available, a long trench that is dug out with 6 to 10 feet deep and 12 to 36 feet wide, depending upon the local conditions. The refuse is compacted and covered with excavated earth. So where the ground level is there and level ground should be there, so that where the methods like following, the trench is dug for 6 to 10 feet depth and deep enough of that 12 to 36 feet wide, and these conditions might have make the refuse to dump in it and fill with the earth, that is soil on the surface. And the second one is ramp method. The ramp method is used where the terrain is immediately sloping. Some excavation is done to secure the covering material. So some excavation like a terrain methods where the moderately sloping method is there, where we will be doing same procedures. Area method. This method is used for filling the land depressions. The refuse is deposited and sealed on its exposed surface with the mud cover. This method has a disadvantage of requiring supplemental earth from outside sources, so that we should get the material, that is the soil, from the outside sources. Chemical and bacteriological and physical changes might occur in the buried refuse, so that the temperatures rise from 60 degrees centigrade within 7 days and kills all the pathogens and hastens the decomposition process. It takes 4 to 6 months for complete decomposition of the organic matter into the innocuous mass. This is where the controlled tipping method is done. What is incineration? Refuse can be disposed of hygienically by burning or incineration. Incineration is a process of burning. So, in this requires the preliminary separation of the dust or ash from the refuse, and incineration involves heavy outlay and expenditure, because definitely the instrument, that is the kilns, might be present, so that for the burning out of the materials of the solid waste, incinerated kilns will be too costlier. There are single incinerators and double incinerators, so that it might be costlier also. So for a burning of the materials, therefore in this it involves the heavy outlay and the expenditure based on the manipulative difficulties. So the disposal of the waste can be done in a community approach. Definitely, if it is a large investor, for like municipalities, or like separate private organizations, where these dumping methods can be done by the incinerations. Composting. It is the process of nature where matter breaks down under bacterial action, resulting in the formation of relatively stable humus-like material called the compost, which is considerably a manurial value of the soil. In the olden times, you can see the dumping of the excreta of the animals, which is being done on the front of the houses, where it is a normal composting matter which works as a manure for the farmers. Likewise, the principal byproducts are the carbon dioxide, water and heat. The heat produced during the composting of 60 degrees centigrade is higher, which destroys the pathogen agents, and the compost formed contains few or no disease producing organisms and is good for soil builder, containing small amounts of major plant nutrients such as nitrates and phosphates. These methods of composting there are different types of methods of composting. They are: number 1, hot fermentation process, that is Bangalore method. This anaerobic method was developed by the Indian Council of Agriculture Research at the Indian Institute of Science of Bangalore. Trenches are dug depending upon the amount of refuse and the night soil to be disposed of. Depths greater than 3 feet are not recommended, because this causes slow decomposition. The pits should be located at least 800 meters away from the city limits. First, the layer of refuse is spread at the bottom of the trench. Over this, a night soil is added. The alternative layers of refuse and night soil is added. That is like sandwiching technique, like having a trench and again a layer of the soil, and again refuse, again a layer of soil. Likewise, the alternative layers of refuse and the night soil are added in a heap rises of 1 feet from the ground level. The top layer should be of refuse at least 9 inches in thickness. Then the heap is covered with excavated earth and compacted. Within 7 days, as a result of bacterial action, considerable heat up to more than 600 degrees centigrade is generated in the compost mass. The intense heat, which persists for 2 to 3 weeks, causes the decomposition of the material. At the decomposition ends within the 6 months, so that a complete and resulting material which is being waterless, innocuous material with manure value. So it is definitely used as a manure. And the second one in the composting is mechanical composting. In this aerobic method, compost is manufactured on large scale. So the refuse is first cleared of a salvage material such as racks, bones, metals, glass and other items which is likely to interfere in the grinding operation. It is pulverized and the pulverizing equipment in order to reduce the size of the particles to less than 2 inches, so that the pulverized refuse is then mixed with the sewage sludge and night soil in a rotating machine and incubated. This entire process of composting is complete by 4 to 6 weeks. This is the other method of doing the procedure of manuring. And the next one is the manure pits. They are dug by the individual householders to dump the garbage, cattle dung, straw and leaves. They are covered with each other in each day's dumping. That is like the manual manure pitting. That is within the houses they will be done. In this 5 to 6 months time, the refuse is converted to manure which is returned to the field. The method of refuse disposal is effective and relatively simple in rural communities. Definitely it is done in the rural communities. It is the oldest method, so that the farming process is done with a good manure products. Burial. The next one. What is burial? A trench is excavated and at the end of each day the trench is filled with earth and compacted. This method is suitable for small camps, so that if you are going for a camps, what is the material that is being gathered from the waste, like for example of the things that is buried in the soil, so that it is said as the burial method. Disposal of healthcare waste. What is healthcare waste disposal? Healthcare waste is defined as all the waste generated by the healthcare establishments like research facilities and laboratories. In addition, it includes the waste originating from minor or scattered sources such as that has been produced in the course of healthcare undertaken in the home, that is like with dialysis, insulin injections, etc. Waste produced in the course of healthcare waste, like healthcare activities, carries a high potential for infection and injury than any other types of waste. Inappropriate and inadequate handling of the healthcare waste may have serious public health consequences and significant impact on the environment. Wherever it is generated, safe and reliable methods for its handling are therefore essential. Definitely, you should handle them with care. What are the categories of healthcare waste? There are different categories that has been classified by the biomedical waste management. So there are infectious waste like the lab cultures, that is waste suspected that contains pathogens, especially what is the lab cultures which has been done. There are infectious waste, and pathological waste are the human tissues or the fluids like the body parts, blood, and the third one is the sharps like the needles, blades which are being disposed, and the pharmaceutical waste is the fourth. That is the expired drugs, what are the drugs that has been used for the trial purposes. Okay, these are pharmaceutical waste. And genotoxic waste that are containing genotoxic substances which may be like carcinogenic products like cytotoxic drugs, vomits or urine of the patients using these drugs. And the sixth one is the chemical waste. They are laboratory agents, reagents, solvents, disinfectants. And the seventh one, waste which are being with the high or heavy metals like mercury. And eighth one is the pressurized containers, that is gas cylinders, aerosol cans. And the ninth one is radioactive waste that are being unused liquid form of radiotherapy, that is with the contaminated glassware. So this is the classification of the categories of healthcare different types. You should be thorough that it might be a 4 marks question or a 2 marks question of asking the categories of the healthcare waste or the classification of the different types of wastes, that is regarding the healthcare. Handling, storage and transportation of the healthcare waste. So every processor has its waste management process, like as I said, for the solid waste or the any types of waste, it is like the handling, storage and transportation of the waste should be done. The first one is the collection. How to collect it and what are the different types of methods of used for the collection of the healthcare waste. This waste is being tightly bagged. What are the color coded things that will be set for collecting different types of healthcare waste? So the waste bags should be tightly closed and sealed when they are being in the 3/4 of full. Light gauze bags can be closed by tying the neck, but heavier gauze bags probably require a plastic sealing tag. Waste should not be allowed to accumulate at the point of production. So waste should be collected daily and transported to the storage site. No bag should be removed unless they are being labeled. The bags and the containers should be replaced immediately with new ones of the same type. So definitely they are being color coded. They are being yellow, red, green and black covers. So these are being color coded. So these color coded bags are being set for that type of materials to be disposed. And the second one is storage. The waste should be stored in a separate room area in the building which is size appropriate to the quantity of waste produced and the frequency of collection. So the storage should be done effectively. The storage area should have an impermeable hard standing floor with good drainage, and it should be easy to clean and disinfect it, and there should be a water supply for the cleaning purpose. Storage area should also have easy access to the staff, that is the waste collection vehicles is essential for taking it. And the third one is the transportation. Waste should be transported by means of wheel trolleys, containers or carts that are being not used for any other purpose. They should be easy to load and unload, and they should do not have sharp edges so that it does not cause any damage to the waste bags, and it should be easy to clean. So these are the methods to be followed in handling, storage and transportation of the healthcare waste. What is the treatment and disposal technologies for healthcare waste? What are the treatment and disposal technologies for the healthcare waste? Their choice of treatment system for healthcare waste should be made carefully on the basis of the various factors that may depend on the local conditions. Their quantity of waste and disposal capacity of the system, type of waste, infrastructure requirements, training requirements for operation of the method, operation and maintenance considerations, and available space. And investment and operating costs and regulatory requirements. And what are the different types of treatment and disposal options for the healthcare waste? There are 7 methods. There are incineration, chemical disinfection, wet thermal treatment, encapsulation, micro irradiation, safe burying, and inertization. So these are the different treatment and disposal options for the waste disposal of the healthcare waste. So by this I will conclude for this class, and in the next class we will discuss regarding the treatment and the disposable options of the different types of healthcare disposal. Thank you.